Hi, Dr. Adam Goldman from the Metropolitan Vein Anesthetic Center here. I'm here to talk about the topic of how do you know if you have a vein problem. And I really am going to split up into two different topics or two different talks. So today we're talking about the acute vein or acute pain problem. And someone may present with sudden onset of pain in their leg, and there may be some other physical factors that they may find. So we're going to go over that. So one thing it could be is it could be a problem with your artery. So you can have the sudden closure of an artery, and that will cause a lot of pain, and it is a very urgent or emergent problem because if you don't take care of it, you can have damage to your leg or to your feet. So one way to know if you have a artery problem is that when you feel the area that is hurting, it's all presents with pain, you're just going to feel cold to you because the artery is blocked and there's not enough blood supply. So that's the biggest way to tell between a vein and an arterial problem that happens acutely or suddenly. The other thing that it could be is it could be an infection of the skin. So the same thing, you may feel a lot of pain. You may feel, though, this time warmth. You may also see swelling. It'll be tender. Often you will see a cut near the area that may have caused it. Sometimes it's not as apparent, but that is certainly something to think about and to be evaluated. The next two possible problems is either an acute superficial or sudden superficial vein thrombosis or a sudden deep vein thrombosis. So those are two different issues because one is not so serious and one is more serious. So when you have a superficial vein thrombosis, same thing. You may have the sudden onset of pain, swelling, you may see some redness, but there the pain may be localized. So you're touching a spot, wow, that hurts. Also, you can feel sometimes what's called a cord, which is a hardening underneath the skin, which is actually the vein that has closed off. And sometimes it can be caused by trauma. It could be caused by people who have underlying vein disease, and sometimes just happens spontaneously. And then the other very important thing to distinguish is if you have a deep vein thrombosis. So once again, this can be tough to tell from the physical exam. You may have swelling, tenderness, some discoloration of the skin. This is a much more serious problem because the clots that form in the leg can break off and go to the lung and cause what we call a pulmonary embolism. So this needs to be treated very quickly and with blood thinners. So how can one tell? Well, first thing is if you have a sudden onset of severe pain, you probably should go see the doctor or go to the emergency room. So the next step is we do an ultrasound, and based on that ultrasound, we can see if the problem is the vein. We also can check for the arteries as well at the same time. It's a similar ultrasound, but both can be evaluated. And that way we can tell what your problem is. So if you're feeling a lot of pain and you have time to come to the clinic, certainly you can do that. If not, go to the emergency room. If you have any questions, please come visit us at the Metropolitan Vein Anesthetic Center. We're at www.nymetrovein.com. And please call us or consult us whenever you have a question. We'd be happy to help you and to take care of you. Thank you.